Well, a stroke is a brain attack or a clot that occurs in our brain. Similar to a heart attack, it's a vascular disease, so it occurs in the brain the same way. It causes many different symptoms than a heart attack, but it's essentially the same process. The people at risk for stroke are varied. The #1 risk factor for stroke is hypertension, so the great majority of the population have that over 50. Also conditions like diabetes, an irregular heart rhythm called atrial fibrillation is another frequent cause of a stroke as well. And there are other factors like high cholesterol, smoking, sedentary activity, things like that. The signs and symptoms of a stroke can be quite varied depending on what part of the brain is affected. But there is an acronym we like to use that is called FAST. F stands for face. That means a facial droop or facial weakness. Typically that happens suddenly. A stands for arm, and that means arm weakness or a droop in the arms that occur when you put your arms out straight like you're holding a tray. S stands for speech, and that can be difficulty with words in terms of slurring speech or in understanding what's being said. And then T stands for time, and we like to have people get to the emergency room as soon as possible so we can treat it. Those symptoms typically account for about 80% of stroke. There are other symptoms, things like difficulty with vision, dizziness, sudden severe headache, and issues with balance and gait that can also be symptoms of stroke as well. And people can even have such a severe stroke that they're unconscious or in a coma as well. Time is very critical because there's a medicine that we can provide in the emergency room that helps break up that clot so that it decreases or limits the damage that is done to the brain tissues. It's very time sensitive. We have to be able to give that drug within 3 hours of the symptoms occurring. And the problem with that is that typically strokes don't hurt, whereas a heart attack, people typically have chest pain. But for a stroke, it may not hurt. They may just have numbness or weakness, and oftentimes don't recognize that as a stroke and seek emergency care as soon as they need to. 80% of strokes can be prevented if they are managed. So the #1 cause of stroke is hypertension, so taking blood pressure medication as prescribed, following up with your doctor on a regular basis is very important. Also managing your diabetes, managing your atrial fibrillation by, again, taking the medicines and following up, having the tests and procedures that need to be done to manage those things. Also eating a healthy diet, and there really isn't a healthy brain diet necessarily. What is brain healthy is heart healthy, so it's basically the same kinds of things. Watching salt intake, watching fat intake, watching your cholesterol levels, things like that are important with that. Being active, exercising regularly, not smoking, avoiding things that can cause problems with the medications you're taking and so forth.